So let me introduce to you the first speaker, which is John Ryan. He is Director of the Commission Public Health, Country Knowledge, Crisis Management Directorate, and since September 2016. Most recently, he led the unit responsible for health determinants and inequalities. He was a Commission representative on the board of the European Lisbon Drugs Agency and is currently the Commission representative on the board of the European Centre of Disease Prevention and Control. So please may I ask you to give your lecture about the European efforts to address migration and health.
Good morning, ladies and gentlemen, and thank you very much for this invitation to what should be an interesting event. I'd like to thank in particular the Federation of European Academies of Medicine for organising this discussion, because indeed, as previous speakers have said, the importance of migration and migrants' health cannot be underestimated, and therefore to have a reflection today on this subject is extremely welcome, and indeed the Commission and its health department will be very interested to see the results of your reflections. Because the input of academies of science and medicines is extremely important in having an evidence base for policy making. And this is one of our key intentions in the Commission, is to have policy based on evidence. Difficult on a subject like migration, of course, because politics usually comes first and then evidence comes afterwards. But I mean, we'll maybe talk about that later. So, first point is that migration and forced displacement is not something which is new, but it's something which is accelerating. And at the level of the number of international migrants has dramatically increased since 2010. We have an increase of 51 million out of a total of 272 million. And this has led to a political imperative to act on a national level, to act on a regional level, and increasingly to have global activities and global agreements. Of course, terminology is quite important, and I think it's important to recognise that migration takes place for different reasons. I mean, within the European Union there's a right of migration, a legal right to move from one member state to another. It's not what we're talking about here today, of course, but these terms are used interchangeably, I would say, and whereas the intra-community migration has taken place since the European Union was founded, the challenging situation is where you have principally third country nationals coming into the European Union, and particularly where the numbers of those people moving is seen to be unplanned and uncontrolled. And that creates a political problem, and it also creates a problem for our health systems. So in terms of the levels, you can see that there is a global level where United Nations, where international organizations, for example the World Health Organization, the UN bodies, the regional authorities such as the European Union and the Member States have all reacted in different ways to the challenges they face from migration. In the case of the European Union, the large-scale entry of migrants as a result of the situation in the Middle East led to huge political strains for the European Union and also between member states. This was added to perhaps by the fact that the Schengen Agreement has led to the removal of internal border controls between the member states, and therefore the traditional means of controlling movement have largely been abandoned within the European Union and the external frontier reinforced. Now, when you have such large numbers of people arriving in situations of distress in our territory and then moving between the member states in an uncontrolled way, this creates a political, organisational, logistical problem. And it also, of course, has knock-on effects on the health systems, both at the stage of reception and also at the stage of passage and final destination. And this, as with any other problem, has consequences on how our budget is spent. And our budget, I would say, is very much at the service of policies. So it's a fairly flexible mechanism which allows us to mobilise funds, and this is what we did in 2015 and 16, to mobilise funds across the European budget to deal with the consequences of these unplanned movements of population. And to give you an idea of the size of the investment which was made just for this unplanned movement, we're talking about 15 billion euros which was spent from the European Union budget over a period of 2 years. And this is twice the amount of money which we're going to spend in the next 7 years on health research. So that gives you an idea of the size of the investment. And that, of course, doesn't count the money which is spent by the member states, because the member states are the ones who are bearing the brunt of whatever costs arise from this situation. But the European Union budget was mobilised quite quickly to try and react and support the member states. And in particular, we tried to overcome the fragmentation of our external European Union policies and our internal policies in order to ensure that there was a better coherency between the two. Now, we see that there is a continuous rise in pressure from migration and a continuation of instability beyond our borders. The existing Commission, the one that's in place at the moment, has of course treated migration as one of its main priorities, and that's reflected in our budget plan also for the next 7 years. So we have a new budget plan which is being negotiated at the moment from 2021 to 2027, and we recognise that as a result of all the changes that have taken place over the last few years, there will be a need for investment and substantial investment in migrant-related issues in the forthcoming financial period. I mentioned a lot about finance during my talk, and you may say, well, why is he talking about money when this is a health conference? Well, the two are intimately linked, of course, because if you try and have a policy without having the means to carry out the policy, then it's just hot air. So I wanted to reassure you that in addition to having a political priority, we also have the means to actually implement change on the ground through the EU budget. What we're trying to do as well is to ensure a better linkage between our humanitarian and development efforts through multi-annual financial planning in order to ensure stability and sustainability of what we're doing. Migration management, for example, will become an important aspect of our foreign policy, our common foreign policy, mobilising our diplomatic staff, mobilising our common security and defence policy, because of course all of these unplanned movements also have a consequence on security, and of course mobilising as well our efforts on climate change. We have a new framework as well with regional partners, and an example of this would be the Emergency Fund for Africa. So what we're trying to do is to link our different policies more coherently, and also to mobilise all of our tools, whether they are financial or political tools, in order to try and address and foresee the problems and try and develop solutions for migratory pressure. And finally then, as I said, finding solutions on the regional level. Now, I put up a slide here on climate change because in itself we could talk for the whole day and probably the whole week on climate change, but it's clearly a very strong driver for migration. And in addition to what we talked about earlier on, of economic deprivation, of security, instability in certain parts of the world, the third factor is, of course, climate change. And you have the Paris Agreement, you have all the EU legislation and commitments in relation to climate change, but there's very often a disconnect in people's minds between climate change and the effects on population movement. And I think this is something which is one of the drivers which is going to actually increase in the coming years. And we will see movements of population which will be driven by climate change issues. This is why the Commission, which is incoming for the next 5 years, from December onwards, will be launching a process on our Green Deal, which will bring together a number of different initiatives linked to environment and health and climate change. We also talked about the instability caused by political events on our borders, the Middle East being a good example, and we should note that the humanitarian aid budget has been mobilised very strongly to support countries affected by instability, and particularly I'm thinking here about Syria and Libya, where humanitarian aid so far has reached over 7 billion euros, which is exactly the budget for health and research over 7 years. So that gives you an idea of the size. The money we're spending on these two countries corresponds to the entire budget for health research for 7 years. But in addition to this effort which has been made to support the security situation in those two countries, we can also mention the work which has been done with neighbouring countries such as Jordan, Lebanon and particularly Turkey, and I'll come back to that in a moment. One of the consequences of the security situation in the Middle East has been a reinforcement of our external borders and the creation, in fact, of a specific agency which is devoted to the protection of the external borders. And you're probably aware of the organisation of joint maritime patrols between the member states in order to save people travelling to Europe across the Mediterranean in very difficult situations, which has resulted in a large number of lives being saved. And people don't very often talk about that, but we know that a large number of migrants have been picked up through these joint maritime patrols. We've also managed to disrupt smuggling gangs who are actually taking money to transport people from one side of the Mediterranean to the other. And of course people traffickers. So you have a very mixed situation. It's not only migrants travelling on their own, it's also networks and gangs of people exploiting the situation of migrants. And finally I would mention that a consequence of the last few years' situation has been also the creation of a European Border and Coast Guard service, which is being gradually rolled out and which has a very large number of people intended as staff, and we hope that this will also contribute to better organisation of the border controls. So what are our key objectives in the European Union as defined in the different policy documents that have been agreed by the Council of Ministers? First of all, to promote a regular and well-managed migration, to address the root causes of irregular migration and forced displacement. Thirdly, to improve the impact of migration on development in both country of origin and destination, to ensure the coherency of different policies, which is something I mentioned earlier, to ensure the sustainability of funding, and to enforce the EU role as a major actor at the global level. In other words, that we shouldn't only react, but we should also act in advance and preventively. And what are the key tools for our policy? The policy is based on the European Trust Fund, the European Union Trust Fund, which focuses on Africa. but also our Stability and Peace Instrument, which has been used, for example, to reinforce the Turkish Coast Guard and to address protection issues for migrants. A third example would be the Partnership Instrument, where we've worked with China and India on addressing the root causes of migration, and the European External Investment Plan, which was launched in September 2017 as a way of reducing the irregular migration through sustainable development, job growth, and scaling up investment in partner countries. So you can see a number of joined up approaches and instruments have been created, both on an ad hoc basis and now on a more permanent, sustainable basis across the European Union policies in order to try and improve the situation of migrants, but also to stabilise the situation in the countries of origin. Now, turning to the migration flows, we talked about the period when there were large migration flows both into Europe and across Europe. This is an interesting slide because it shows the period 2015-2019. So if you look on the left-hand side of the slide, you see the total irregular migration arrivals. And on the left-hand side of the slide, you have the beginning of the process in 2015, if I can see this correctly. And then gradually you're going down, and quite dramatically you're going down. And this shows, to some extent at least, the effect of the measures that have been taken and which I've described, both in the countries of origin, in the countries of passage, and also the financial and political investments that have been made over that time frame. So the bottom line of all of this is that irregular arrivals in the European Union have been reduced by almost 90% over the period in question. This is a more recent slide which will give you the picture from the 4th of November this year to the 10th of November this year. And you can see here that there were 1,500 arrivals from Turkey into the European Union, 133 through the Western Mediterranean or the Atlantic route, 36,000 migrants present on the Greek islands in the hotspots, 10 returns from Greece to Turkey, and a little bit over 3,000 voluntary returns from Greece to countries of origin. In the same period, we've had a large number of asylum applications in the European Union. And in this context, when we're referring to the hotspots in Greece, I should say that we have been also trying to develop resettlement agreements between the member states in order to ensure solidarity, so that the countries of arrival are not left to deal with the full responsibility of the arriving migrants, but that there is solidarity between the member states. And as those of you who followed the file will be aware, there are many political issues around that, and there is no consensus on the system of shared responsibility which is being proposed by the Commission. Now, again, you can see from this slide the arrival areas in the European Union for illegal migrants or regular migrants. First place is Greece, of course. Second is Spain, and third is Italy. And on the bottom of the slide there, you've also seen that over 1,000 migrants are estimated to have drowned in the Mediterranean while crossing from the south to the north in 2019. So, what is the EU's effort to help? The EU's effort to help is focused on improving our partner countries' capacities to put in place medium or long-term measures and solutions. Secondly, to address the root causes of illegal migration and forced displacement. And thirdly, and probably most importantly, to address conflicts persecution, economic hardship, and lack of access to social services, and climate change. You can see it's a big agenda, and the drivers of migration are not going to disappear tomorrow. So that's what I said at the beginning. I think this is something which is going to continue and increase in importance in the coming years, despite all of the efforts we're making to try and reduce these drivers. The internal preparedness and resilience is focusing on developing capacity, especially at the points of entry, and to improve border management systems, and fostering resilience and opportunities for socio-economic integration, particularly for young people in the European Union. In terms of legal migration and mobility projects, the European Union Emergency Trust Fund for Africa has set up workers and students mobility projects to match job offers and job demands. We have also invested significantly through AfriPol and AmeriPol in fighting smuggling networks, in providing technical and financial support against migrant smuggling and people trafficking, improving our border security, strengthening regional partnerships, particularly with African regional organisations, but also with the Arab Leagues, for example, and providing rapid response, for example, in Myanmar, in Afghanistan, in Yemen, and in the countries bordering Syria. There are a number of new EU rules in respect of asylum procedures. The qualification directive talks about how we determine international protection for asylum seekers. And the revised Dublin regulation enhances the protection of asylum seekers during the process of establishing the state responsibility for receiving them. Now, in terms of enhancing the integration of non-EU nationals in EU societies, this is something which is also a focus of EU policies, but the internal EU policies, in order to maximise the opportunities offered by legal migration and also the involvement of migrants in EU societies. It's a long-term project. We see, for example, that the health sector can serve as a catalyst for social and economic development. Investment in our health systems is between 10 and 16% of GDP. So if we leave out the health systems from our consideration of migration and the involvement and integration of migrants in our societies, we also neglect an opportunity, I think. I'm talking here not about the health of the migrants themselves, it's about the involvement of migrants as part of the future of our health systems. And as we know, with an ageing population, as you know, with a shortage of people for the health workforce in almost all of our member states, there should be a consideration given to how we would be able to benefit from the skills of migrants and develop the skills of migrants to be part of our future European Union health systems. And this also involves, for example, the training of migrants to be part of their own healthcare. So, for example, in several member states, migrants have been trained to provide a bridge between the migrant community and the local healthcare system, benefiting either from their original qualifications or from their language skills or cultural skills. So this is something which is a sign that the health system is reaching out, in fact, to in a special way, integrate in many member states the skills of migrants. Now, in terms of migration and health, which is the subject of this conference, and I've talked about a lot of other things, just to set the picture, but most migrants are healthy, in fact, when they arrive in the European Union. This is confirmed by the appreciation of the countries of reception, whether it would be Cyprus, Greece, Spain, Italy, and so on. They're of course affected by the conditions of travel. They may be suffering from physical exhaustion, from distress, from dehydration, from cold. And of course the experiences which they had in their home countries and also in the transit from their home countries can also affect their physical or their mental health in the longer term. And I'd like to draw your attention to a statement which was agreed by all of the European NGOs concerned with migration and health. They adopted a joint statement in June of 2018 which repeats the right of migrants to health regardless of their status or background, and the right to equal access, preventative and curative care, including mental and health care services. So this is a very strong statement from all of our NGO community, which is of course a community we work with in the European Union in the migrant file. We also work very closely with the World Health Organization and the IOM. So the Commission is not only seeking to work with Member States, with other international organizations, but also with the NGO community. And I should mention the Red Cross here as well, of course. Now, if you had to summarize, you would say that the investment which we have made politically in the WHO EU Universal Health Coverage Partnership, is perhaps a horizontal approach, but it's one where we hope that by improving the quality and the sustainability of health systems worldwide, we can also drive down the movement of populations and improve the quality of life of people in developing countries. There is also an EU consensus on development which contributes to our development policy and to reducing again the pressures on people to move from where they live. Our Asylum Migration and Integration Fund is the financial basis for all of this. And internally in the European Union, the health programme has been making a number of contributions to projects specifically aimed at improving the health of migrants in the European Union. It's intended to promote health, reduce health inequalities, to protect people from cross-border health threats, and to encourage sustainability in our health systems. And we have been carrying out projects, particularly during the crisis period, in order to help the countries of reception deal with the pressures from the unplanned migration. And we worked through the World Health Organization, but also the International Organization of Migration and NGO groups in order to do that. So improving healthcare for vulnerable migrants, training healthcare professionals to deal with migrants, particularly by improving interpersonal skills and cultural mediation, improving the monitoring of communicable diseases in those populations, which is an agenda in itself, I would say, integrating migrants into the national healthcare systems in the countries of reception, developing contact points for health with those in charge of asylum and civil protection, and sharing best practice models. All of these are things where we have invested in the European Union through the health programme in order to deliver specific interventions. So we're not only looking at the frontline countries, but we're also looking at the situation of migrants when they arrive in their country of destination. And we're not limiting ourselves to the health system, but we're also trying to integrate the approach of social workers and law enforcement officers. And this has been an interesting exercise to try and bring together the experience of NGOs, migrants' representative organisations, health professionals, and law enforcement officers, and to get them all in the same room dealing with the issue of migration was not easy, but it's something which we think brought a certain added value. In terms of the third health programme, which is being planned, it's in its final stages at the moment. You have a number of projects which I think will be relevant. And what we're looking at the moment is how to carry these forward and to deepen this investment in the next financial period. Because, as I said before, our planning is for the next 7 years. And we have planned for a new health programme for the next 7 years, which is substantial investment. And we want to make sure that this investment is also of benefit for the training and for the consolidation of what's been learned so far. And that's why I'm putting up some slides on our training projects, because I think they do ensure reinforcement of knowledge and expertise across the European Union. The third health programme, as I say, is coming to its end this year. In the future 7-year programme, the European Social Fund will take up the health activities. And secondly, there will also be substantial funds available in the Horizon Europe Research Programme, about 7.7 billion euros over 7 years. There will also be the Migration, Borders and Security cluster of the budget, which will be a specific envelope of financial resources available to support projects and investment in the areas of migration, borders and security. And we have, of course, the Asylum and Migration Fund, which is planned to be 10 billion euros over the 7-year period. The cohesion funds and the European social funds will also be used to support the integration of migrants in the member states. And this will have 3 focus areas: one on asylum, secondly on legal migration and integration, and thirdly on countering illegal reception. So I hope in these few slides I've been able to give you a taste of the global situation, the fact that we had a crisis of movement into the European Union which caused a lot of political instability and difficulties, and this led to an increased awareness of the importance of migration as a topic on the European Union agenda, and this is translated in turn into a series of legal policy and financial instruments which have been rolled out over the last few years and which are going to be rolled out over the next 7 years. So thank you very much, ladies and gentlemen. I'd be very happy to follow the rest of your conference.